Hi Terry, I'm Jessica. I'm gonna talk to you a little bit today about smoking instead of depression. Is that okay?
Yeah, that's okay.
Okay. I thought we could start off by talking a little bit about your smoking habits because I know you have had a history of smoking. Is that correct?
Yes, that's
Okay.
right.
So could you maybe start off by telling me a little about like how much you smoke a day, what kind of cigarettes you're using?
I smoke about 2 packs a day. I started when I was 14. I smoke Camel cigarettes with no filter.
Okay. And I was looking in your charts and I saw that you have a recent diagnosis of chronic obstructive pulmonary disease. Is that right?
Yeah, that's right. I've been having a lot of shortness of breath, coughing, and a lot of sinus infections recently.
Okay. Well, I'm going to tell you I am a little bit concerned about your smoking habits. Is it okay if I maybe tell you why I'm thinking the way that I am?
Yeah,
Okay, so with the quantity that you're smoking, 2 packs a day for as long as you have been, about 10 years. How old are you? 24? Yeah. So, yeah, so 2 packs a day for 10 years, that's enough to have long-term health effects. So it really doesn't help with your COPD. It's probably the reason why you're having a lot of shortness of breath and sinus infections. It can also cause infertility. I don't know if you're thinking about having kids in the future, but long-term smoking can cause birth problems, pregnancy issues, rather, and it increases your risk for heart attack and cancer. So if you, I don't know if you have like a family history of cancer or.
yeah, that's how my dad died when he was 66 from lung cancer.
Okay,
So too.
okay. So yeah, hearing about your habits now, it definitely worries me a little bit because I want to see you continue to be healthy, and continuing smoking might not be the best path for that. Is it okay if I ask you, well, first, have you ever thought about quitting?
Yeah, but I don't know if I'm ready to because last time I tried, I got really depressed again. I'm just not ready to handle that.
Okay. So it sounds like you're a little worried that you might fall back into that depression?
Yeah.
Okay. Well, I completely understand that. I know it's changing something that drastically is a very scary thing, but we do have a lot of resources here that will be able to help you if you do decide to. On a scale of 1 to 10, 10 being the most important, 1 being not important at all, how important do you think it is for you to quit?
Probably about a 3.
Okay. Do you feel that you are ready to quit?
Not quite ready just because of the depression thing.
Okay. If you had to rate it on a 1 to 10 scale, if you decided to quit, how confident are you that you would be able to do it?
Probably only like a 2.
Okay. Well, I think that if you should you decide to, I think it would be A, very good for your health, and B, I've looked at your progress notes through your therapy, through your hospitalization due to your suicide ideation, and in the 2 months that you've had that issue, your depression, you've made a lot of progress, and I think that if you decided to quit smoking, I think that you are on a very good track to be successful with that. So, I want to talk to you now a little bit about pros and cons. Can you think of any benefits to quitting?
But I guess that way I could be a better role model for my niece and I could get to hang out with her more because my brother won't let me be around her when I'm smoking.
Okay. Okay, how old is your niece?
She's 10.
Okay, well that's good. Being a good role model for kids that young is a great goal to have. I think that would be really good for you.
Yeah, it'll make my family a lot happier too.
Yeah, I definitely believe that. I think that's a great benefit. Um, do you keeping that in mind? Do you think that would make you more likely to quit smoking?
Yeah, that would probably be my main motivator.
Okay, well that's good. I think that your ability to identify a main motivator is a great step. Um, is it okay if we maybe talk about going over a plan for quitting?
Sure.
Okay. And I know you said you might not feel like you're ready right now, and that's okay, but I really hope that this plan will help you in the future. You know, if you ever feel like you might be ready to, it's good that we have this laid out right now so you have an access to it. So, let's see. Where do you keep your cigarettes?
In my purse.
In your purse? Okay. So maybe something you can do is keeping them, or just keeping them in a place that you won't be able to get to them, or just getting rid of them completely, out of sight, out of mind. It won't necessarily decrease cravings, but we have medications that can help you with that. We have support groups that can help you with that too. Should you decide to quit, it would be a good idea to set a specific date to go completely abstinent. We like to say within 2 weeks from when you're feeling ready. That way it gives you time to taper off. So you said how many packs are you smoking a day? Two? Okay, so maybe that means you can just slowly go down for the 2 weeks until you're ready to just completely stop. We also like to have patients identify triggers. Can you maybe think of anything that triggers you to?
Hey!
Can you think of anything that might trigger you to have the urge to smoke?
Another trigger might be school.
Okay. Well, I would encourage you to write those down and keep them in mind. That way, it can be a good reminder to, maybe not get stressed out. Maybe take a step back from those things that are stressing you out, that are triggering it, and find a better way to cope with it. We also, as I mentioned before, we have a lot of support systems and support groups that I can refer you to. I'll give you this right here. This is a number you can call. This is a website that has a lot of good tips, and then this is an app, so you can have it on your phone.
Okay.
Do you have any questions for me?
I don't think so.
Okay, do you feel like talking about it has helped you at all in your motivation?
Yeah, I think so. You're making me feel like I could probably do it.
Yeah, I really think you can, especially seeing the progress that you've made with your depression. I think you're in a great place to develop a healthier habit and live a healthier life.
Thank you.